Well, we're here with Dr. Mary Carlson, a podiatrist, a foot doctor in Williston, New York. Hi, Dr. Carlson.
Hello, Helmut. How are you today?
Good. Well, Dr. Carlson, today I'm going to ask you a bunch of stuff about feet. Aren't you happy I asked you about feet and not about teeth or other stuff? So let me ask you, what do you think is one of the main concerns people have with their feet, or one of the main things people should take care of their feet in order to avoid major or long-term problems? Give me something. If you would have one message for people with feet, which is, thanks God, almost everybody. There's very few people who somehow lost their foot here and there. But what should they be taken care of? What are they on an average neglecting? And if you have that 1 or 2 points you want to get across to them, what would that be?
All right, the first point I'd like to make is that everybody should really have an annual foot exam. We take for granted our feet. We walk all day. We stuff them in shoes. We run. We jog. We do sports. But we don't pay much attention to them unless we have some kind of pain or problem. So the first thing I'd like to say is really that we should always have a foot check or a visit to a podiatrist or foot and ankle specialist once a year. Make sure that the mechanics of the foot are correct, that the shoe gear is fitting properly, that you're walking correctly so you can continue to be healthy and maintain a healthy foot.
Okay. That's number one. You said 2 things.
Okay, 2 things. Are we looking
for... I don't know. That's what I thought you said.
No, that's the main thing, is really to get in every year for an examination and have somebody professional look at your feet. Okay,
well, what are some of the things you detect there which people wouldn't know if they wouldn't come to you? What are some of the things you detect?
Well, a lot of times what we detect are problems. People come in saying they have pain in their foot, in their big toe, or in their heel or their arch, and they're blaming it on their shoes. And really what the problem is, it's the mechanics of the foot, or the structure of the foot, meaning it's their foot type that is actually causing this problem, not the shoe that they believe that they're wearing that is too tight or too narrow that causes the problem. So once you find out the pathology or the reason why they have this problem, then you can help the person. It's really not an issue of the shoe causing the problem.
Okay, but you say the person should come in and get a foot examined once a year or once every year and a half or so. However, let's assume the person doesn't have any pain, and you think he still should be getting examined to make sure that he stays proper. So a person who doesn't have pain, what is it quite often you find that the person, he's like, I don't have really foot pain. Sometimes when I kick my dog, of course I don't do that. Nobody kicks his dog, but sometimes if I run into my table, then my toe might hurt for a little while. But rather than that, I don't have any foot pain. Why should I come to you and check it out every year or 2?
Because, as I said prior, what happens is once you come into the podiatrist, we can look at your foot, analyze your foot, look for any kind of structural problems that will lead to pain in the future. Sometimes flat feet, falling arches will lead to problems in the future, such as bunions and hammer toes, or arch pain, heel pain. And you may not necessarily have that problem to begin with, but the way your foot is made or developed, you are in line to get that problem in the future. So if you come in early and you see us, we can do some things to prevent these problems from actually exacerbating or becoming a true problem causing you pain.
I see. So basically, there are signs and reasons why a bunion and why other foot pains develop, which you see them and then you can adjust these things so that they never happen. A little bit like with a dentist. You can actually prevent your teeth from falling out if you regularly fix the tiny little things which come up.
Exactly right. if we analyze the foot, and actually if there is some structural problems and we correct the way they walk with an orthotic or shoe gear, we can prevent these problems from really occurring full-blown, having that very bad bunion or that very bad heel pain or hammer toe. So it's really preventative, early onset, early treatment. If you see somebody on a regular basis and you catch these things, they won't wind up with the full-blown problem in the future if it's taken care of, which is very important.
I got it. Now, is there any type of age associated with, like, so should younger children, teenagers, is it the same, come every year or two, make sure that things are correct, or are elder people more prone to get things out of wacko or whatever? Shed some light on it.
Well, really, it starts with children. I mean, children really start walking correctly, heel-toe gait at the age of 2. And what happens is at that point, if the mother notices that the child is walking flat-footed or complaining his legs hurt, they should get him in because as I said, foot structure is hereditary. Those problems are hereditary, and they're getting the manifestation of that. A lot of times teenagers, we see them, they start playing a lot of sports, soccer, basketball, baseball, and they start complaining, my feet hurt, my legs hurt. Again, that's an indication where they should come in and be seen, because if they're getting leg pain, it's a muscle imbalance, and that usually stems from the way they walk and a foot problem. Again, middle-aged people, women in their 40s, they complain about their shoes and bunions and corns, but a lot of times it's not from the shoe, it's from the foot problem. And then again, elderly people. Number one problem with elderly people is circulation. Most people over 50 or 60 are on high cholesterol medications, and plaque forms in arteries all over, not only in our heart, but also in the arteries in our legs. And another way with podiatrists, we always look at the feet and check the circulation, and we feel pulses and see signs if there is any kind of vascular disease or PAD, as they call it. And that's another early warning sign for an intervention, is to really get in and see somebody and have that circulation checked to make sure that it doesn't lead to problems later in life.
Wow, all right.
So it's all age groups.
Yeah, so again, just like back with a dentist, you should be seeing a dentist even before you have teeth, and then continuously, and there's always a different particular illness or problem or symptom which could possibly be arising, which is more common for different age groups, but nevertheless, you always got to go fix and to prevent. Well, thanks a lot, Dr. Carlson. Thanks a lot. It's very informative.
No, you're very welcome.